What do ambiguous CORT scan results mean for lung cancer? Imagine looking at a detailed picture of your lungs and seeing something that's not quite clear. That's what happens when a CORT scan shows ambiguous results in the context of lung cancer. It means the findings are uncertain or inconclusive, making it hard to say if a lung lesion is cancerous or benign. This can be confusing and stressful, but it's a common part of the diagnostic process. CORT scans are a key tool for diagnosing and staging lung cancer because they produce detailed cross-sectional images of the lungs. But even with the most advanced technology, some findings remain unclear. Small lung nodules or lesions that don't stand out sharply from the surrounding tissue can be difficult to interpret. Sometimes, measurements of a tumor can vary slightly between scans, not because the tumor is changing, but due to technical factors or measurement differences. Location also matters. Tumors near the central parts of the lung, close to blood vessels or bones, can blend in with normal structures. This makes it tricky to tell if what you're seeing is a tumor or just normal anatomy or benign changes. The interpretation of these scans depends heavily on the radiologist's experience. Mistakes can happen if subtle abnormalities are overlooked or misread. Technical issues like patient movement or poor image quality can also make results less clear. Another challenge is measurement variability. Studies show that repeat scans can differ by a few millimeters in tumor size, which can make it seem like the tumor is growing or shrinking when it might not be. When additional testing is done, such as biopsies or molecular analysis, results can sometimes be ambiguous or borderline, adding to the complexity of diagnosis. When a CORT scan result is ambiguous, doctors usually recommend further steps. This might include follow-up scans after a few months to see if the lesion changes in size or appearance. Sometimes, a PET scan is used to evaluate metabolic activity, helping to distinguish benign from malignant lesions. A biopsy may be performed to get a definitive diagnosis by examining tissue under a microscope. Consulting with specialists in thoracic imaging or a multidisciplinary team can also help interpret the findings and decide the best next steps. In essence, ambiguous CORT scan results highlight the limits of imaging alone. They reminded us that diagnosis often requires a combination of imaging, clinical evaluation, and sometimes tissue testing. These results don't mean cancer is certain or unlikely, but indicate that more information is needed. It's important to follow your healthcare provider's advice and undergo the recommended follow-up procedures. Remember, each case is unique, and your medical team will tailor the approach to your specific situation. If you have concerns or questions, always consult with a medical professional who can provide personalized guidance based on your health history and the latest scientific evidence.